Yeah, good morning, ladies and gentlemen. Yes, today we continue with disaster management and preparedness. So, we are going to look at a very crucial topic today of emergency preparedness and response planning. So, by the end of this session, we should be able to understand the importance of emergency response planning, should be able to explore the concept of incident command systems. We should be able to learn about effective communication and coordination during emergencies. Should also be able to gain knowledge of resource management and logistics in disaster situations. Should be able to understand the essentials of evacuation planning and shelter management. Should be able to understand the roles and responsibilities of government agencies in disaster management. And lastly, we should also explore the contributions of NGOs or non government organizations, community organizations, and volunteer groups. So, there are a couple of learning objectives and a couple of slides here, but we are going to take a break halfway and resume in another recording. So, since we have a lot of work, let's go straight into it. So, what is emergency response planning? It is all to do with developing and implementing strategies to respond and manage emergencies or disasters effectively. And it is crucial to have that comprehensive plan or an all-round plan to mitigate risks and ensure an organized response. It's a very crucial component of preparedness and managing disasters and risks so that you can respond in an organized manner. And the key elements of an emergency response plan include identifying the potential hazards, and we looked at how we can identify them in our previous session, establishing communication protocols or those rules and regulations and guidelines on how to communicate effectively during a disaster, either to the people, to all the stakeholders, and everyone that is concerned in management of this disaster. Then defining the roles and responsibilities of the stakeholders in disaster management, then outlining resource allocation, how the resources that are going to be used to avert this disaster, how are they going to be allocated? Then you have to coordinate all that is going to take place or coordination of all these procedures. Then, as we said in our learning objectives, we have a critical term called incident command systems. So these provide a structured emergency management framework, and in this case or in this system, roles and responsibilities are clearly spelled out. Roles of each and every person that is going to take place in management of a disaster. The roles of those people are spelled out, and there is also a coordination mechanism and a chain of command in this system. So the personnel in this system have specific roles, such as the one who commands the incident, called the incident commander, the operations chief, who is responsible for the technical bit of the management of this disaster or this or that incident, and then the planning chief who will effectively plan on how to do the evacuations and everything that is going to be taking place. Then logistics, the resources that will be needed. So there should be someone who is also responsible in coordinating all that, who is called the logistics chief. Then the finance or the administrative chief should also be able to avail the financial resources that are needed so that everything can go on smoothly without any hindrance of financial constraints. So all these are the roles of each are very well spelled out by this incident command system, and it is advantageous in a way that uh, during an emergency there is improved coordination and enhanced communication and efficient resource allocation due to having this incident command system in place. And it is based on key principles such as unit of command or having one voice as a disaster management team, then modular organization where people have specific roles, but they can also be put in other roles, but they, 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 they can be transferred to another part of that disaster management team, but the roles are clearly spelled out for them. And that brings us to another point of being flexible and scalable in nature so that in case you're needed in another area of the disaster management team, then you can also be be able to be useful in that place. And then comprehensive resource management. So each and every resource is used in a very comprehensive manner when you have this incident command system. So apart from incident command system, or that system which spells out the key roles and responsibilities of each and every team member of the disaster management, we also have to talk about communication and coordination. So effective communication is very essential during emergencies to ensure that there is timely exchange of information and instructions. And there can be challenges, including limited infrastructure to put up to have effective communication. Then sometimes there could be high demand for these communication channels, and because of that limited infrastructure and financial resources, sometimes the demand might not be met. For example, some people might be far away from the grid and they need communication, but it is not readily available. Then language barriers, sometimes, especially the technical people, might want to talk to these local communities, but they are limited by the language. Or sometimes you can be displaced to another place where it is hard for you to communicate to each other. So such things hamper communication greatly, and they are the challenges. But there can be strategies of improving such communication and coordination, including establishing dedicated communication networks, which are majorly tailored for addressing challenges in uh, in communication during disasters. So these ones will be dedicated to communicate about to communicate or transmit messages on disasters and how to respond to them. Then utilizing different communication channels so that you can have a synergistic effect by having radios in place, using TVs, using newspapers and social media. All these, if used at a go, they can create a synergistic effect in communication during a disaster. Then we have conducting regular drills and exercises. So we should be proactive when we are preparing to communicate, especially during a disaster. So that is why we need to conduct drills and exercises so that we can improve communication and coordination. So technology plays, of course, a crucial role in enforcing communication during emergencies, and tools like two-way radios or those walkie-talkies that law enforcers usually carry, those that transmit and receive radio waves, are very essential during emergencies Then we have satellite phones, which you can use across the globe and communicate without having to go through those mobile phone operators, or without using a SIM card. So those satellite phones are also very essential in emergencies. And we also have social media, and then platforms that can help facilitate communication. So all this, when used during emergencies, it can create a better communication and coordination. And this is all because of technology that we are having right now. So establishing communication networks and protocols beforehand ensures that there is seamless communication among the response teams, stakeholders, and public. So apart from ICS, or command system and communication, we also have a very critical part of emergency management, which is resource management and logistics. So in this case, resource management in disaster situations involves identifying those critical resources such as personnel, equipment, supplies, and ensuring that there is availability and efficient utilization of these resources. And then logistics planning is crucial for managing the flow of resources and supporting operations during emergencies. So all these resources, the supplies, the equipment that are going to be used during emergencies, are effectively managed by doing what we call logistics planning. So allocation and distribution of resources should be done based on thorough assessment of the needs of the people or the community, and then the priorities and best practices for efficient re- resource utilization includes monitoring. It includes monitoring inventories, or the things that are stored, then establishing mutual aid agreements. For example, if there is a limitation in resources in a country, for example, in South Sudan, then they can outsource for resources in a neighboring country, and that will be called through an agreement called the mutual aid agreement. Then conducting trainings and exercises, then implementing effective logistics systems which are used to effectively manage all these supplies, the equipment that are going to be used during emergencies. We have evacuation planning, which is a critical aspect of emergency preparedness to ensure that the affected populations are safe, and the the evacuation itself is done in an orderly fashion. So the factors that you have to consider when developing an evacuation plan is that you have to identify the evacuation routes. You shouldn't use shortcuts, but instead use routes which are clear enough, the ones are not going to be that are not going to put people who are being evacuated at risk of death or injuries. Then we have establishing assembly points. So there are always like places where people can assemble during emergencies. For example, at petrol stations, you always see those assembly points. In case of fires, then people can always gather there because it is always safe, and it can always be accessed by people who are going to transport either the victims or those people who are still safe to a place which is safer or a place where they can receive treatment. Then we have considering the needs of vulnerable people. So during an emergency, there are always people who are vulnerable. For example, those people who cannot understand the warning signs, because of maybe an impairment, or sometimes they could be having a mental disorder that could be preventing them from understanding those warning signs, or sometimes they can be unable to help to rescue themselves. So those are, and it's maybe because they are physically disabled, so they have to be assisted, and that is what we are calling considering the needs of those vulnerable populations. Then you have to coordinate with transportation authorities, those people who are going to take them to a safer place or to a place where they can receive first aid and treatment. So, conducting regular evacuation drills or exercises in a proactive manner before even a disaster strikes or before an emergency. We should be able to conduct these drills and exercises because it helps assess the plan's effectiveness and uh, identify the areas that need improvement. So, evaluating and updating these evacuation plans based on the lessons learned from those drills and real life events is essential for enhancing preparedness before even the disaster occurs or before an emergency situation. Then another crucial area that we need to interest ourselves is shelter management in disasters or emergencies. So they are vital. Shelters are vital in providing temporary housing and essential services to displaced individuals during emergencies, and they include evacuation centers, all those centers that are already in place to cater for emergencies or to offer shelter or housing to people in case they face emergencies. Then there are community centers, all those places which the community uses for other things, but in case of emergency, they can be used. For example, the schools, which can be able to gather a lot of people at the same time. So these shelters are vital in providing temporary housing and essential services to displaced people during emergencies, like I had said earlier on. So we have different types of shelters, such as the evacuation centers, like we had already talked about, community centers or schools, which which serve different purposes based on the needs of the affected population. So planning and setting up this shelter should involve location selection, whereby you select a suitable location for you to do this evacuation. Then capacity assessment, you're looking at the capacity of the community to cope with a disaster or an emergency. How able are they? Look at their vulnerabilities. Are they able to construct permanent houses? Are they able to be having the recommended meals in a day? So all that is assessing their capacity. Then staffing to do this planning and shelter management. We have security and provision of basic amenities like water, electricity, and other things that are needed even when you're in an evacuation center. So shelter operations and services involve registration and intake procedures. Whenever you're setting up these shelters, you should register the people that you have provided this shelter to, food and water, which are the basic needs, medical assistance, psychosocial support, because they have undergone a disaster. They need to be supported in that psychosocial area, whereby you counsel and provide hope to them that things will be better, and coordination with external organizations. So, collaboration with those external organizations like NGOs, government agencies, and volunteer groups is crucial uh, for efficient and effective shelter management. They are very crucial in that. So, collaborative efforts and coordination among government agencies are essential to ensure an effective and coordinated response. So, if you need your response to be coordinated and effective, then you need to encourage collaboration between the government agencies, the community based organizations, the non government organizations, and the community itself through their leaders. That collaboration will enable you to have an effective and coordinated response. So, non government organizations play a very significant role in disaster response and recovery. They provide various services such as search and rescue in case there is a building that has gone down, or in case of the collapse of of a mine. Then you can use NGOs to do this search and rescue, to search for people who are trapped under the rubbles of buildings and then rescue them. Or during flooding, some people might be washed away by floods, but they are still alive. So searching and rescuing them can be effectively done by these NGOs. Then they can also provide medical assistance. They can do relief distribution of essentials like clothes, like food, and they can also offer psychosocial support, or that support to take care of the mental health of these people who have been affected by disasters. So they can also effectively do that. So, and then community organizations and volunteer groups contribute to disaster management by engaging in preparedness activities, or those activities before the disaster. Then they also support the local communities and assisting with response efforts. So they work hand in hand with these NGOs to do that. So examples of NGOs involved in disaster management include the Red Cross and the Red Crescent societies. Then we have Medicine Sans Frontiers, or in English, what are called Doctors Without Borders, and then a lot of CBOs, or the community-based organizations. And in South Sudan, we have organizations which are community-based. For example, there was Friend Friends Indeed. South Sudan is a community-based organization that deals with providing that psychosocial support. It deals with mediation. It deals with resolving conflicts, especially at community level. So collaboration effects between government agencies, NGOs, and volunteer groups are very essential to maximize the effectiveness of disaster response and recovery. Like I said, when you have these entities collaborating with each other, then you're able to realize a synergistic effect, or an effect that is greater than the organizations or the entities working individually. Then we have another key player in disaster management, which is the private sector, and it plays a crucial role in disaster response and recovery efforts contribute by providing resources, expertise, and financial support. So there should also be partnership between the government and these private sector people, so that we can leverage on their resources, or the private sector resources and capabilities, for more efficient and disaster for more efficient and effective disaster management. So examples of private sector involvement in disaster management include providing logistical support, all those resources, the supplies, the equipment that is needed, offering temporary shelters. So these private organizations can also offer temporary shelters for the people who have been displaced by disasters. They can donate essential supplies, for example, those that are used in homes, uh, clothes, jerry cans, basins, all those that can be provided by the, the private sector. Then donating essential supplies, and and also deploying specialized teams. So they can also deploy those specialized teams, or those teams that can be technical in nature. They can also be facilitated by the private sector. For example, the doctors who are going to handle those emergencies in disasters. Then they can also deploy engineers to put in place facilities that will be needed during emergencies. So all that can be possible if there is a public-private partnership. So sometimes they do this using a phenomenon called corporate social responsibility. So this is more of the things that business people, all these private sector people can do, that is beyond the expectations by the public. For example, if a pharmacy or a pharmacy business or a pharmaceutical business constructs a borehole to provide safe water drinking for the community that has been displaced from where it was, then they are doing what we call corporate social responsibility. So it involves playing a significant role in supporting the affected communities during and after the disasters. So collaboration between stakeholders is crucial for effective disaster management, and coordination efforts between government agencies, NGOs, and the private sector help streamline or to effectively use resources and avoid duplication of efforts. So the efforts that are put in place to manage these disasters should not be duplicated. When one organization is doing, for example, construction of boreholes to provide clean water, then another organization shouldn't also construct boreholes, should use those resources to provide some other thing. Okay, so they can now focus on menstrual hygiene or construction of pit latrines, so that there isn't duplication of these efforts. Already the resources are not always enough in those settings, so you shouldn't duplicate the efforts. Then establishing effective partnerships and communication channels enables efficient information sharing and coordination between these uh, entities that are collaborating. So whenever you're collaborating, or whenever there is collaboration between these amongst these stakeholders, it can only be sustained if there is effective partnership and communication channels. So joint planning and exercises involves multiple stakeholders, which helps to build familiarity, trust, and effective working relationships. For you to work together to achieve the goal of averting or mitigating a disaster, then there should be trust and familiarity between or amongst yourselves, and you should have that working relationship which is done or which is enforced during these joint planning and exercises. Then there should be sharing resources and expertise among stakeholders to enhance the overall response capacity. Whenever you have resources which you can share with another, so that you achieve the bigger goal of mitigating these disasters or effectively managing these disasters, then you shouldn't hesitate to share with a colleague in the struggle of this disaster management. By collaborating, stakeholders can collectively build resilient communities that are better prepared for future disasters. So the responsibilities of stakeholders, there should be clear delineation of roles and responsibilities among stakeholders for effective disaster management. So each stakeholder group, including the government agencies, the NGOs, the community organizations, and the private sector, should have clearly spelled out obligations and expectations during emergency planning and disaster management. And understanding and fulfilling those responsibilities and obligations will enhance coordination and cooperation amongst those stakeholders. So there should also be training and capacity building for the stakeholders to ensure that they are well equipped with the necessary skills and knowledge to fulfill their roles effectively. And maintaining readiness and preparedness allows the stakeholders to respond promptly and effectively during emergencies. And this readiness and preparedness is maintained through this training and capacity building. But even this should be done on a continuous basis, or what we are calling continuous improvement and evaluation of stakeholder roles and responsibilities, which will help identify the areas of improvement and adaptation. So we cannot talk about disasters or emergencies without talking about medical response. So medical response to disaster refers to the coordinated provision of medical care and support during and after a disaster to mitigate injuries, to save lives, and promote recovery. It plays a very vital role in mitigating the impact of a disaster on the health of the people and the community. So medical emergencies can happen at any time uh, during an emergency, during a disaster. So being prepared is very crucial, and having a first aid kit readily available and knowing the basic first aid skills, as we shall see. So as a public health official, you shouldn't think that you're going to stop at going to the community and educating them about the proper health practices. But sometimes when you're faced with an emergency, you need to also be knowing some bit of first aid. And it is also crucial to have a first aid kit with you so that you can effect or you can provide this first aid. So, common emergencies include heart attacks that can be identified by chest pain, shortness of breath, and numbness in arms. So, whenever, of course, blood is cut off to those extremities like arms, then you will have this numbness. Shortness of breath is majorly caused because there is not enough oxygen being transported. So that is what we are calling the shortness of breath. Then, so another medical emergency is choking. which can be treated using the Heimlich maneuver. So the Heimlich maneuver is majorly it can also be called an abdominal thrust, whereby the person administering this first aid will hold just above the navel, or what we call the umbilicus of the victim or the person choking, and then will push upwards and inwards. So you push upwards and inwards so that you can create that pressure in the airway to dislodge this choking material or this thing that is causing choking. So when you hold above, you hold your fist with another hand above the navel or above the the above the umbilicus of the victim. You bend them forward and then you push inwards and upwards. Then you're able to create that pressure in the airway, which can dislodge this choking material, which could be food or anything that is choking this individual. And that is what we are calling the Heimlich maneuver. So knowing some of those first aid uh, first aid techniques will help you to mitigate or to save a life during an emergency. Then we have seizures, which are common in epileptic patients, and there are those uncontrollable movements of the limbs, which can be very severe and they are rapid in nature. There is contraction and relaxation, but which is in a rapid fashion, and it is common in those people who are suffering from epilepsy. So it can be managed by ensuring that the person is safe and removing any dangerous objects which are nearby, so that when they are undergoing that seizure, which is caused by abnormal firing of those impulses in the central nervous system, they are safe, or they do not injure themselves, because those rapid contractions and relaxations of these limbs can cause injuries if there is a dangerous object nearby. So you need to make sure that their environment is safe for them, so that when they are undergoing that seizure, they are not injured. So having a well-stocked first aid kit and knowing basic first aid can make a difference in an emergency situation, and you should be prepared. But most importantly, when you're administering this first aid, you should stay safe. So you shouldn't try to administer first aid and end up also needing first aid. So you should be able to establish that your safety is guaranteed before you even administer this first aid. So you can always look out for the contents of the first aid kit, but we need to have basically bandages, so that we can do immobilization of these limbs whenever there are those emergencies like fractures or bleeding or sprains and strains. Those are very essential tools that can be able to immobilize such emergencies. We need to have things like uh, razor blades, safety pins, all those and many others, like you're going to see, are essential components of the first aid kit that need to be in place so that you can conduct an effective first aid. So steps that can be taken during an emergency are to call for emergency medical services immediately. You need to alert those people who can who can effectively treat this person, and they can be alerted through emergency medical services or those ambulances that can take them to a place where they can receive treatment. Then you need to administer first aid. And when you're administering this first aid, you need to stay calm and reassure the patient or the victim of this emergency. So reassuring always takes care of the psychological bit of this casualty or this patient, because they are already anxious due to the injury or the harm that has happened to them. So you need to reassure them to create that sense of hope that they are going to be better. And when you're doing that, you yourself should stay calm. You shouldn't be all over the place. You shouldn't be fearful. But when you're calm, you create that spirit of hope in this person that they are going to be better. So first aid in itself, the critical or the most important thing, or the one of the most important thing is knowing CPR or cardiopulmonary resuscitation, which can save a life. So you do this by performing chest compressions, whereby you press the heel of your hand and interlock it with another hand over the breastbone or the sternum, and then you compress downwards firmly, giving around over 100 compressions in 1 minute. So, like in 2 seconds, you're giving two compressions, and then in between the compressions, you give the breaths. So after the 100 compressions, no, after giving 30 compressions at a rate of 100 compressions in 1 minute, so you give 30 compressions, 30 chest compressions, and then two rescue breaths, and then you continue until help arrives or the person becomes better. Or you can use an automated external defibrillator, which is used to which can be able to send an electric shock that can resuscitate or restart the heart that had stopped, if it is available. But in most cases in developing countries, they are not readily available. But if it is available, then you can use it, the automated external defibrillator. But if it is not available, then you do your chest compression, 30 compressions at a rate of 100 compressions in 1 minute. You give those 30 compressions and do rescue breaths until help arrives or until the person begins to get better. And these chest compressions are majorly to push blood from the heart to the vital organs that need it, like the brain, the heart itself, the lungs, the liver. And when you do this compression, which is firm and effective, which is it will be able to deliver this blood to those vital organs. So very critical also of first aid is to call for professional help immediately, especially in those life-threatening situations like heart attacks, cardiac arrest, stroke. You need to alert the emergency medical services or an ambulance that can take this person to receive professional help immediately. So when you call for this professional help, you should do that if the person is unconscious, if they are unable to breathe, if they have severe chest pain that could indicate that they are having heart attack, if they are bleeding heavily, because there can be bleeding that can be stopped by applying pressure. But if you apply pressure and the bleeding is not stopping, then you need to alert professional. You need to alert the emergency medical services that can be able to take this person for to access professional help. Or if there are signs of stroke and heart attack, if the person is experiencing numbness, or they are experiencing a lot of pain in the chest, then we should be able to alert these emergency medical services so as the victim to receive this professional help. So planning and responding to medical emergencies involve pre-event planning and preparedness, which are crucial for effective medical emergency response. And these include stockpiling the medical supplies. So whenever you're preparing for an emergency, then you need to stockpile these medical supplies. You should be having medical supplies in terms of bandages, in terms of gloves to prevent cross infection between the person who is giving first aid or and and the person who is receiving it. Then equipment and pharmaceuticals, all those medications that are going to be used to ensure that there is this readiness. So you do stockpiling. You make sure that you have you make sure that you have the medical supplies, equipment, and pharmaceuticals, so that you can be ready for anything related to medical emergencies. Then collaborating with hospitals and emergency medical services, which are called the EMS or the ambulances. The public health agencies and volunteers can enhance response capabilities. Then we have scene management, which involves organizing and coordinating medical resources at the incident site. So initial assessment of the situation, triaging patients based on the severity of injuries, and establishing treatment areas. So whenever there is a disaster that has struck, you should be able to assess the situation and triage or assess these patients in terms of severity of their conditions. Yeah, so if a person is having a closed fracture and the other person is having heavy bleeding, is experiencing stroke, and has an open femoral or an open fracture on the of the femur, you should at least give this person who is having the open fracture more priority than this person who is having a closed fracture and they are able to walk by themselves. So that is what we call triaging patients or prioritizing patients. It doesn't mean that you're going to neglect the other person, but it means that you're going to give more priority and respond to the person who is more likely to die. You're going to respond to them faster than this person who is less likely to die. So that is what we are calling the triaging of patients based on severity of injuries, and then you make sure that you establish where they can receive treatment. So effective communication among medical teams, the incident command system, and other response agencies is very essential, so that you can always have good referrals and transportation of these patients to places where they can receive treatment and they can be able to heal faster. So coordination with law enforcement and other personnel can ensure scene safety and security. So whenever there is a disaster that has struck, for example, if there is a building that has fallen, that has gone down, then there should be law enforcement, because whenever there is such a thing, then you expect some malicious people to take advantage of that and maybe do some robbery. So that is why we need the law enforcement in place to ensure that there is safety of this scene and then security, so that even people who are going to administer first aid, they are guarded and they do it without fear. So adhering to personal protective equipment requirements and protocols, or the guidelines, will protect the medical personnel and the patients. Like I said earlier on, you need to protect yourself and the person that you're working on. If you're a first aider, or if you're administering first aid, or any other medical personnel that is going to treat this patient who has been affected by a disaster, they need to be protected by putting on those gloves, by washing hands before doing any procedure, so that you don't transmit an infection to the patient, or get an infection from the patient to you. So that is why you need to adhere to those personal protective equipment requirements and protocols. So, what is medical organization? Establishing medical facilities and treatment areas in coordination with the incident command system. This involves setting up temporary medical clinics, involves putting up field hospitals, or using the existing ones, but making sure that they can handle the increased capacity or the increased number of patients. So that is what we are calling the surge capacity. So you can either use the existing ones, but increase their capacity, or their capacity to handle more patients, or you can put in place field hospitals or temporary medical clinics that can be able to handle emergencies. Then assigning roles and responsibilities to the medical personnel and ensuring that there is adequate staffing, supplies, and equipment. Managing patient flow, including the registration, triage, like we had talked about earlier, treatment and transportation to and from the hospital or the medical clinic. Implementing patient tracking systems so that you can monitor the movement and the status of the patient, so that if it is a communicable disease, or a disease that can be spread from one person to another, then you can know where this patient was able to move to, and maybe the people that they were in contact with. And then most importantly, how and if they are recovering. So the safety at the scene of a major incident is very critical to protect the medical personnel and the patients, and adhering to PPE requirements or personal protective equipment is also very, very, very essential. Like we said earlier, it is essential because it helps in prevention of cross infection between the patient and the medical personnel. So you need to wash your hands with soap and water, be able to put on those protective equipment like gloves, goggles, and and maybe gumboots sometimes. So you should be able to identify and mitigate hazards like structural instability, if the structure or a building is unstable and is liable to fall even with with a little force. Chemical exposures or infectious diseases are all hazards that can be experienced whenever you're going to give an emergency treatment or first aid. So establishing a decontamination area, if necessary, to handle hazardous materials is also essential in safety of a scene of the major incident. Regular safety briefings and ongoing treatment to ensure awareness of scene safety protocols. So there should be regular trainings and briefings about these scene safety protocols. How are you going to protect yourself from these exposures? How are you going to protect the person you're going to work on? So they should be on a regular basis. This training should be ongoing so that you can increase the awareness of scene safety protocols. So after the event, Then there is always transitioning from immediate response to the post-event phase. So there should be continuation of medical care for those who still have injuries and conditions. Then a very important aspect is to provide mental health support for those who have survived the disaster and those who are responding or the responders. Because even when you're responding, there is that traumatic bit of having to experience or having to treat those people. So the responders also need to be mentally supported because they might develop post traumatic stress disorder or PTSD. So that is why it is essential to provide that medical health support for the survivors and the people who responded. Then collaboration with public health agencies for disease surveillance and outbreak control. Yeah, because some disasters might lead to outbreak control, to outbreaks. So you need to coordinate and collaborate with public health agencies so that they can do that surveillance. For example, if they have floods, then you expect waterborne diseases, vector-borne diseases. That's right. During those conditions, they should be able to be handled by public health agencies. Assessment of healthcare infrastructure damage and planning for recovery and building and rebuilding is also essential in the aftermath of a disaster, conducting debriefings and analysis to identify areas of improvement in future responses. So debriefings are always like those meetings or assessments done after a response has been put in place. So you need to see how you did what you did, how you did it, and how you can improve in future responses. And this is done effectively when you conduct a debriefing. So you need to do this so that you can improve your future response. So because it is a very long session, we need to pause and reflect as a public health professional. How prepared are you to manage a disaster? Do you have skills of first aid? Do you have skills of evacuating people from, for example, a fire? You know, so if you don't have such skills, what measures are you putting in place to gain them? Okay, what proactive measures are you putting in place to gain such skills? So it is a reflection kind of moment for us before we continue with this session. So let us meet again in a few minutes to continue with this session. Thank you.